The Women's Self-Help Podcast is a place where women can go to find support, information and tools they need to take control of their own health. We discuss the needs of women so you can become your own self-help guru. From how to manage your stress, eating for effective weight loss, real talk on self-image, maintaining lifelong health and healthy aging, we cover it all. Be sure to visit womensSSHH.com for more information on everything discussed in today's episode.
Hello and welcome to another episode of the Women's Self-Help Podcast. In this episode, I am joined by Dr. Edward Clark from St. George Health and Sydney Health Professionals. In this episode, Eddie and I dive into discussing what is an osteopath and what they can help you with. We discuss some of the causes of pain and also the surprising but crucial aspect that mental health plays. We also talk about what is ideal posture and the concept of ideal posture, and also fatigue resistance and how having fatigue resistance can help prevent back pain. We also discuss the hormonal changes that happen to women in menopause and also in perimenopause, and how this can affect both the spine, your tendons and your ligaments as well. For all the latest episodes, don't forget to subscribe on iTunes or head to www.thewomensselfhelppodcast, that's women'sshp.info/subscribe. Without further ado, let's get into the episode. Today I'm joined by Dr. Eddie Clark, qualified osteopath at St. George Health and Sydney Health Professionals. Eddie is a highly qualified manual therapist working with practical experience in both Australia and the UK as a senior lecturer at Oxford Brookes University. He has extensive experience working with treatment of neck and lower back pain, as well as rehabilitation of sports injury, both of which we'll dive into a little bit deeper today. So thanks so much for joining us, Eddie. Can you just start a little bit about your background and how you became an osteopath?
Yeah, thanks, Megan. That was quite a good read of that CV. It's a bit embarrassing to listen to it.
Oh my gosh,
my background as an osteo, I went into osteo straight from high school. So I didn't have there was no big story about why I got involved in it. I had some advice from a tutor that I had at the time who said it would be a good career with an aging population and you could do some good work with it. So, I chose it. It was between osteo and something like international relations and diplomacy at UWS. They were my choices.
Okay.
So the osteo, it would be that or be I suppose end up as a bureaucrat like that. So I did that at UWS and I quite enjoyed the course, although it was very challenging. We did a 5-year degree, so it was 3 years undergrad and 2-year masters. And then I worked for a couple of years and my girlfriend and I were pretty keen on traveling, so we picked up and moved over to England. And that's where I ended up working in higher education within osteopathy. But I had to pass their registration exams, and that was a big, difficult process. But once I got in, I had a master's degree from the UWS course, and they were transitioning into a master's model for English osteos. So I was highly attractive for teaching for their undergrad component because of masters, and I ended up getting a job at Oxford Brookes, which was a great experience. I lived up there for a couple of years and worked, and it gave me a lot of my background in my clinical interests, because eventually I lived over there for 3 years or so, and then we moved back to Australia and commenced marriage and kids and all the rest of it. And there's no osteo degree in Sydney anymore because UWS closed down its osteo and its podiatry course, and so it was clinical practice or move to Melbourne or Lismore. So I stuck with clinical practice, and it's been really good.
So did they not actually have a master's program in the UK when you were there? Were you sort of starting that up, were you?
Yeah, they were pushing to transition to a master's program. So I think they started one whilst I was there. But the kind of works like if you're working in education, you should have the level of degree above the standard that you're teaching. So if you're teaching on an undergrad, you should have a master's degree. And if you're teaching to master's students, then you should have a PhD. That's generally the way that it works. So there weren't that many osteos with master's degrees at that time. Now there should be a heap of them because most of the degrees have transitioned. So
With the sort of people that you're seeing, so you're working in Sydney at the moment, obviously at St George Health and also at Sydney Health Professionals as well. What sort of your experience is with back pain and sort of with neck pain as well? Obviously, you've got that experience with rehab now, working with some more athletes. What's the most common kind of things that they come to you, or what would they see an osteopath for?
Yeah, I think most of our list is that garden variety neck and back pain. And most of those guys in at Sydney Health Professionals, which is Broadway, it's almost a CBD crowd, so you get a lot of office workers. And at Cogro, it's a bit more varied. You get a lot more, I tend to see a lot of like junior athletes, like a lot of rep soccer players up to about 18. And I see some swimmers as well. But again, still probably the majority is kind of like your neck and your back pain with a fairly sizable chunk of shoulder issues, like a kind of gym crowd, like the kind of people at KMG that you get with shoulder pinches and sore hips and things like that as well.
Yeah.
So I guess the thing is with osteo, you can see an osteo for anything that is painful, and we can assess and diagnose it. People don't tend to know when to see an osteopath. So I'd say if you've got body pain, you can see an osteopath. It could be in your foot or your neck or your upper back or your shoulder, hip, toes, or anything. So
yeah, let's talk about that a bit, because I think there is sort of a bit of some misconceptions around it and when they should go and see someone. Like you say, they don't automatically know when they should go and see an osteopath. So what's some of the misconceptions that you sort of find about the profession itself?
Yeah, I think people tend to find their way to osteo often after they've tried the other, so physio and chiro.
Yeah.
Sometimes massage, or if they've been recommended, really. So I think a lot of our message to people is to try and get out there that osteo is viable. It's an option, and I obviously am a bit biased, but I think it's a good option for manual therapy options. So I think trying to get that message out that we can see you for all the kind of pains that you might see a physio or a chiro for is part of our strategy in clinic. And when we talk to people like yourself, I've got a kind of controversial opinion on the difference between the physio, chiro and osteo, if you want to hear it.
Yeah, let's hear it. Let's go.
But my thing is when someone says, because it's probably the most common question that you get, and I know that physios and chiros will get it all the time as well. And I actually think that the best way to look at it, there's really no difference. If you're an economist and you're saying, chiro, physio and osteo, they perform exactly the same function. You've got a sore issue, shoulder, whatever we talked about before, the list of things. You're going to go and see a clinic with a physio, a chiro, or an osteo. They're going to treat you using variations on the theme, similar techniques. They're going to charge you money for it, and they'll probably give you some advice and hopefully some exercises as well. So I don't think that all the differences that it's splitting hairs. There isn't really one that's better than the other in a professional sense. I think what you find is there are individuals who do very high standard of work, and there are probably some individuals out there that do pretty crap work as well.
We're all about making the body move better. So in a way, you're all working together to achieve the whole purpose of the three professions together is to make that individual injury-free and moving better and more able in their everyday life. So there's going to be overlap anyway.
Absolutely, Megan. I think, the gym world is pretty much the same kind of thing that you're doing at work every day with clients is what we're doing. It's just that we probably tend to attract people who are injured, breaking down a little bit, have pain, whereas you're kind of work with a fitter cohort. So I think that's all lofty ideals. We're really just helping people move better. It's absolutely correct. That's the simplest and the best way to look at it.
Yeah, and I think it's really doing people a disservice when they try and sort of separate themselves out. I think if you all kind of work together and see there's a place for everything in making that person injury-free or move better, it's the overlap of all three that eventually gets the best results. I mean, that's just my opinion anyway.
Yeah. I think some therapies or therapists fit well with some people. That's
exactly,
how I'd say it. So, for example, I have patients who might come to me and they don't really, I'll give them, the advice and the spiel about taking care of themselves and being accountable and doing the right exercises and properly harm minimizing, building up strength or flexibility. But they're quite happy to delegate to me sometimes. And, they'll come back every time they have an injury. And if I keep hounding them to do keep doing this stuff, I'll say, I'll keep telling you this, but if you don't want, I'll do it for you. If you come back here, fine. you're injured every time, I'll do the work. But otherwise, I always push that self-accountability thing. And some of my clients on the other side of the spectrum, they'll come in once with an injury, they'll really listen, and they'll notes, and they'll take my exercise sheets, and off they go. And I might not see them for 6 months, and it's a completely different issue. So there's just a bunch of different types of people out there, and some of them are real self-reliant and self-directed, and some of them are not. And you just got to be able to kind of tailor your approach to fit the person. And sometimes that's different therapies. It's physio or chiro, or it's massage, it's osteo, and different practitioners. So
yeah, I think it's about getting to understand their own body too, and that they need to obviously put in the work on both sides to get those results. And I mean, I'll have some people that will come and say to me that they've had a specific injury and they might have gone and seen a chiro for it, but for their particular injury on their body, it would have been better to see an osteopath such as yourself, or maybe they were better for physio for that particular injury. Had it been a different problem, then maybe that chiro would have been the right person to go to. So it depends on, I always say to them, it depends on where your injury is and how it's manifesting and how you got it in the first place and how it's affecting your life as to what works best. And also that it's not a quick fix. You've got to invest in your own recovery too.
Yeah, and I think for you as a trainer who really takes an active interest in your client's well-being, and for anyone that's listening, I think the first question I would say is, do you like your therapist? Do you have a good rapport with them? One of the most important things that comes out of research into kind of positive outcomes from stuff that we do is there a good therapeutic relationship? Do you trust the person, and will you listen to them, and take their advice and act on it? So just asking around, it's fine if you went and had a really good outcome with someone, but you really didn't like them, that can be useful. But if you find that maybe someone's struggling with an injury, they're getting therapy for it, you can ask the question around, or ask yourself, do I really like this person? Do I trust them? And I think if the answer is no, then you should look elsewhere. I think don't waste more time with someone who you don't have that relationship with. You need to find someone. Mostly in the musculoskeletal world, it's not rocket science, but with some of the issues that we deal with, they can be a real drag for people's lives, like ongoing back pain or shoulder or hip bursitis. They can go on for months and even years sometimes, and they should be fixable. It's something that you should be able to, most of them will be fixable with the right treatment and the right advice.
And do you think too, with injuries like those that can drag on if they don't get the right advice, do you think it's important to kind of have that discussion? I mean, you've touched on it with building that rapport as well, and give the client or the patient a reasonable idea of how long their recovery will take for the injury that they've got?
Oh yeah, for sure. So that upfront, that's part of anything difficult, you've got to call it straight away, I find.
Managing their expectations a bit as well.
Yeah, I was going to say reasonable expectations. You've got to make sure that their expectations match reality. That includes sometimes kind of removing them of ideas they might have that are unhelpful. So, for example, I get some clients who'll come in and, because I do a bit of spinal manipulation, clicking joints in the back, and sometimes someone will come in with a real difficult issue and they want me to click it back into place. And I just, that's not a useful way to think about an intervention. The spine is not just a stack of blocks that get out of shape sometimes. It's just magnitudes more complex than that. There's a whole world of physiology and chemistry and neurology and muscular tissue, which can be in various states. So just that reasonable expectations is probably the biggest thing with anything that's a little complicated. You've got to ask people what they expect and what they think's going on, and you get good at kind of zeroing in on when that doesn't match what your experience of reality is. That's for difficult issues. The straightforward issues, for most garden variety neck and back stuff, it's pretty quick fix if you know what you're doing and they're not stuck in an awful situation, working an 80-hour week with a crap boss and no control and all those things.
Yeah, I mean, if we're talking about back pain specifically, then do you find it's more an injury they've done to themselves, or is it often more of a coordination thing where they just don't know how to move their back efficiently enough when they're doing certain moves, and it's, in that case, it can be something sort of more quickly corrected?
Yeah. I think most of the stuff that I see that's related to work is kind of like overuse, and instead of posture, like sedentariness in particular positions, I think is the big driver, being still, and, like that's often computer use and desk work. There is plenty that's injury related, like I'll get a lot who it's moving a box, doing gardening in the gym. We'll get plenty of injuries from that, but it's often you ask them some questions and they were doing something they weren't used to gardening, or they've had back issues before is a big risk for having further back issues. So for those people doing heavy deadlifts or something first thing in the morning, I'd say, ease off. So yeah, like we get people who injure their back, actively injure it, and that's a different kind of protocol to someone who comes in and my back's been stiff for a little while and it's been starting to ache a bit for a few months now and it's been up and down, and that kind of history is different. That's a different kind of intervention. If they just come in and you can see them when they walk in, they can't walk right. It's a bit more of a protocol where it's acute injury management, it's rest, it's some gentle therapy and the right advice.
And so how would you approach treating then, like you just mentioned, the acute as opposed to some of those more chronic, possibly less serious ones?
The acute guys are easy. Honestly, that just kind of like helping them understand what's happened, trying to make sure that they're not unnecessarily fearful, and then usually helping them to kind of realize that scans are probably unnecessary most of the time, and just kind of walking them through the recovery process. So again, like, if they say, my back's gone out, like, okay, but just kind of letting them understand that there's tissue healing is not just kind of mechanical. It's like there's inflammatory processes and cell migrations that you need to be respectful of and appropriate rest, and keep them moving within reasonable constraints. So keep the biggest thing, especially for lower backs, when they injure them a few times, people can get wary of moving. They get worried about it, and that's just moving. You have to just keep moving through the day. It won't be comfortable sometimes, but you just keep doing it. That's the acute management strategies, and a lot of it depends on how bad it is, obviously. But the overuse stuff, that can be a little bit more challenging depending on, the biggest thing is how long have you had pain for. If it's 18 months, that's challenging. If it's 3 weeks, that should be fairly straightforward.
And do you ever get anyone who comes to you and they literally say that they've had bad chronic back pain for like 3 years?
Yeah, for sure. I reckon that's probably 15 to 20% of my cases would be what would fit a chronic pain like label. They tend to talk about persistent pain these days instead of chronic pain because it has less negative connotations. But yeah, there's a lot of people. I think the stat for chronic pain is about 1 in 5 people will suffer a chronic pain related problem. So it's not great, but I think that's a lot of the world that we live in probably drives a lot of that stuff. But yeah, those guys, they require different strategies as well. Like if you can pick them out quickly and start working them, you really do work in a more of a biopsychosocial approach with those guys, meaning you're asking lots of questions about what's your stress factors.
Yeah, I was going to talk about that too.
Yeah, when did this start? How do you feel about pain? Like you really got to, that relationship and the rapport is really important to those guys, particularly because you really need to understand what kind of pressures they're under and what the history of this thing is. Like, what's their story? When did the pain start? And delving into what has happened to them as a human being to like lead them to this place where they're suffering greatly with something.
I think you're right. I think with situations like that with the chronic pain, often it's obviously having that rapport is really important. But sometimes I think when I gradually get to know some of the ladies that come here at KMJ, and when I chat to them after a while, you find, like you say, it's those life stresses and stuff that might have built up. There might have been something that was happening around the time they got the back pain initially, and things have piled on top, and it's often something around the mental health domain that I can see, just from my perspective, to be one of the big contributors to that person that's had, say, back pain for 3 years or the really, really long time.
Yeah, big time. Those things will come in all different types, shapes and sizes. Like that can be bad experiences with medical care, that can be bad advice. That a lot of the times I find that it can be wrapped up with a real, a nasty situation at work. Sometimes with workers' compensation claims that haven't gone right, and it's where what I do overlaps with psychological care. You need to have some skills in kind of sussing out some of those things, and also, a lot of these people will need the care of a good psychologist. Now, we're talking just about people with chronic pain, right? So this is people with pain that's long-standing, 3 months more, sometimes years, and that, you need to work in conjunction with people who can offer services to talk about those kind of things.
Yeah, it's difficult, but even just getting them to kind of acknowledge that sometimes can subconsciously relieve a bit of their pain as well, in terms of their perceptions of that pain, I suppose.
Yep. And recognising that there are ups and downs of pain might be more connected to psychological states than it is to physical states. And I don't say exclusively, but recognising sometimes that pain will be much worse after they've had a very stressful experience, some conflict, a fight. And with all things with pain and biology, like, it's not uniform either. It's very individualised. Like, the human brain's really, it's the most complicated thing, to deal with, and you have to just respect that you can't really box people into easy, what's the right word, like stereotypes with chronic pain. You have to kind of listen and understand, and it's very individualised approach. But I think also with osteo, I tend to think it works a little bit better with some of the chronic pain. I've got no research on that, but traditionally osteo's taken a lot more time to discuss psychosocial kind of factors than maybe chiro and physio. That's changing, but I think, like, something that I do a lot of in my work, and I think you generally will get that more with osteo, and I think that's probably our patient load reflects that a little bit more as well. So
yeah, I think you're right. I think that is, like you said, the brain's fascinating. That's getting onto a whole other topic altogether there, but I definitely think in terms of the perception of pain as a way, again, in conjunction, like you mentioned, with the physical treatment to reduce that perception. I mean, the ladies, I've often used certain techniques, especially with the yoga during the yoga classes, is to really use their brain to focus and concentrate. If we're doing a pose or a stretch or a position that's quite painful, especially if they've got sort of a hip problem or something like that, or hip bursitis, breathing into the area of pain, eventually that pain starts to reduce once their brain's perception of the pain becomes lowered. So stuff like that anyway.
Yeah, but also, like, chronic pain and psychological issues, best advice is go and get some regular exercise. Go and see someone like yourself who's skilled and understanding and they have a rapport with. Like, there's nothing beats the evidence for exercise as an intervention for long-standing pain. And also, like, depression and anxiety, most of the comorbidities with chronic pain, depression, anxiety, kind of related stuff. So exercise, those guys, they come into clinic as a patient. That's probably the first thing I'm talking about. What's your exercise profile like, and what do you feel like about exercise? Do you like it? And do you hate it? Is it something that you miss, or is it something that you would have to drag yourself kicking and screaming to? But yeah, so like complicated stuff where perhaps the pain's not related to, I shouldn't say not related, but not driven formally by some kind of issue in their back or that stuff. I think the most important place for them is the gym, the right type of gym, like a gentle yoga or a yin yoga class or a real gentle exercise. And also with like the gym that you run, Megan, like it's for a lot of the older clientele, I find especially females, they might have a biggest hurdle about getting into the gyms. They have no idea what a gym looks like, let alone being comfortable enough. So you find a place like your gym where they can have a little social interaction and be welcomed in a little network, and people, miss them if they're not there. And, that's a really useful service for a lot of people who don't feel comfortable in the traditional kind of, going to a gym. Especially in good old days, you'd have to go into a gym and all the kind of hulking meatheads are kind of stalking the weight areas and staring at themselves in the mirrors. Like it's intimidating, especially if you're a middle-aged woman. So that, I think it's a really important factor of dealing with more complicated stuff.
Yeah, I mean, that's one of the main reasons I started up in the first place, was because of how intimidating it is for those ladies, and I can see with them here the difference having that support group means in terms of, obviously they're more willing to do what they need to do. They enjoy themselves, so they want to do it. And the ones that are those regulars that come all the time have the social connections and obviously have me there to to make sure their technique is correct and they're pushing themselves to the right level.
You can't underestimate that.
Yeah.
The important that is the social aspect of group fitness when you can offer that. That's a really, really important factor. And also in dealing with another kind of group, the fit active person who's busting to get back to it. The other big group because I do a fair bit of work with some more high intensity gyms and CrossFits and some F45 kind of crowds where they want you in there 6 days a week and they want you doing loads and loads and loads. The social classes there, sending someone going back in when they're a little underdone, they're not quite recovered properly. Don't underestimate how hard that is to go easy for that kind of crowd. So it works both ways, and that you can use it as a real advantage to kind of get someone to buy in for exercise. And if someone's let's say, for example, keeps flaring up a knee tendonitis or keeps spraining their back in a nasty way, those people need to be held back, sometimes almost forcefully held back from getting back into that social class, because once they're in there and the music's going and they're, the blood's pumping and they're warm, they're not going to stop themselves, especially because, the people around them, people notice the trainer yells at them, stuff like that. So it works both ways.
Yeah, those situations are hard. I mean, I've got even individual clients too, and you see them pushing that little bit, and you just got to keep an eye out for those ones. I know what you mean.
The trainer sometimes is just, because I think the most frustrating thing for the gym sometimes is you might lose a good client because they keep injuring themselves, and it doesn't have to be like that. You need someone the trainer who can say, look, listen, I've seen you do this 3 times, it's not right. You got to get it sorted out.
Absolutely.
And work with someone who wants to get you back in the gym, but also will call you out if, that's the hardest patients I have, is trying to hold it back and say, look, you're not right yet. You're not right. You can't go back and do the circuit. You can't go back and do heavy squats yet, because you'll hurt yourself again. And at some stage you'll be right. And it's not, I shouldn't say you'll definitely hurt yourself. Think of it as more of a risk profile. That's the way I like to talk about it with patients these days who are trying to get back to intense exercise. If you go back this weekend, you've got a higher risk of hurting yourself, and you can do things to minimize it. You can keep them out of circuits. You can get them working on scaled back versions, and you have to work in that world now as an osteo or physio-chiro. You have to be able to kind of help people strategically return to an activity. That's the same for sport, managing people returning to a contact sport, football or soccer. You need to be able to, that's a very tricky part of the work that we do.
Yeah, I mean, I sort of approach it in the same way that, I think you can approach it returning to this level where it's just in a gym setting, similar to what you could with professional sport teams in terms of the social aspect. I mean, I've had a few ladies that have had a few injuries that they might be seeing a physio for, and I'll often say, come into the class and you're going to join in the class, but you're going to do all the exercises that your physio is giving you with their prescriptions as your class at the gym, just so they're still keeping that social contact. They don't feel like they're losing part of the group, because otherwise I find if they're away, they might not have the motivation to do the exercises they've been told to do, and I can make sure they're getting them done. Yeah. And B, then it's harder for them to come back. They feel like they're not going to be as good as the rest of the group, or they've lost that fitness. So kind of does both together.
Yeah, and some of them, it's some people who are regular exercisers, it really, you can see it. It's not good for their mental health to keep them out of the gym for too long.
Yeah, I was going to say, it brings it back to that whole discussion comes back in always. They're all tied together.
Yeah. I think that's the biggest thing, for punters, the regular people out there, is just recognising how much we know about the connection between physical health and mental health, And, I think that's behind a little bit of the way that we've seen the fitness industry kind of proliferate and all the varied types of gyms springing up, is that people are getting the message and starting to there's different gyms for different people from different walks of life, and that's great. But recognising that is important too.
And I think getting the clients to understand their own bodies as well, and the connection between the body as an ecosystem, or how all the different systems work together. And that's why I run regular events such as ones with yourself to give them that knowledge. And you were kind enough to come and give the ladies a really good in-depth discussion about posture. And so I just wanted to kind of dive into that a little bit more with you now as well, and just have a bit of a chat to you about how movement patterns and coordination that we have affect our posture. And what you were talking to them a bit about, there's no good, there's no bad posture, there's just better or ideal for yourself. So can you just chat a little bit more about that to me?
Yeah, I think that's one of those, you can go down the rabbit hole on posture. The real, I suppose, where you want to start with it is that if you actually look into, so the idea of bad posture comes from this sense that you see someone really slouching in the chair. Don't sit like that because you're going to hurt yourself, right? That's the crux of why you would say to someone, stand up straight, But if you delve into the research that tries to, because therefore you should be able to get a whole bunch of people who have crap posture, in inverted commas, and you should be able to predict that they're going to have more back pain, more neck pain. That stands to reason, correct?
Yeah, but then, how I look at it too, you'd say, well, if someone came to me and said, I've got bad posture because I sit with my shoulders forward, or if they're, excessively fatiguing their upper traps because they're in a position in that way, well, I'll sort of say, well, if you're going to excessively use your upper traps, then yeah, you might injure them. But if you're not using them at all, then it's not necessarily a bad posture for you.
Yeah, well, I think the problem has been that doesn't work out in reality. If you try and predict people that are going to have pain by postural screening, it doesn't work. They don't have more pain than someone who's got excellent posture. So it's not what we thought it was. I think there are exceptions. It's not just a yes or no equation. There is the shape of your skeleton, which in more or less is fixed after you are skeletally mature, which I think is about 18, 19 for a woman and maybe 22, 23 for a man. So if you've got a scoliosis, if you've got a bit of a hunchback, if you've got your chin sticks out, your bones, to a certain degree, a fair bit of that comes from the way that you're shaped in your skeleton. And you can kind of work around that. You can make improvements, but the improvements that you're making are probably more to things like your fatigue resistance, your muscle bulk. So you'll always have a certain look to your spine. So you can stand straighter. And I think you should work on those things, but it's probably the other side of posture that we talked about at the talk, which is another kind of how deep down the rabbit hole do you want to go, is that mostly posture seems to be more connected to your mental state than your physical state. And that one is a real hard one for people to wrap their heads around sometimes. But if you talk about reading body language, how do you know someone looks depressed? How do you know they look, in inverted commas, they look down, right? That person looks a bit down. Think about the metaphor, right? They look a bit down, meaning they look downtrodden. They're looking down, their shoulders are stooped. So it's more often a reflection of like someone's mental state, and that can be quite chronic. If someone has been, think about someone who's been bullied at school, they tend to adopt certain postures that are associated with poor self-esteem and all those things. And it's the same with the converse, an exceptionally confident person who's got great self-esteem and their life's going great, they tend to walk around proud and they walk erect and their head, eyes are up. So it's one of these weird ones where the brain and your body kind of have this feedback loop going on. So if you think about, the old adage like smile more, you'll feel better. That is true to a certain degree. You can't just fix depression by smiling more, but you can make yourself feel measurably better by smiling more often. So to get these things across to people, you need to be conscious of just kind of like small doses of information so that you don't lose them. It's posture is important and you need to try and work with it. But I think the more important things to talk to people about are what are your habits like in your job? How sedentary is your job? Because the sedentariness is a big driver of a lot of this pain. That's what you can predict, a higher risk of workplace injuries. Sedentariness, repetitive tasks, and a lack of control over what you're doing. Now, think about the third one. That's where it gets really scary because a lack of control in your work is associated with a whole bunch of poor outcomes, both mental health and also physical. So they're things to think about, people. But getting back to posture, so it is important you should work on your physical strengths because it's your meat sack, your machine that carries you around the world. You need to look after it. You need to service it. And servicing it, in my opinion, is going to the gym. And if it breaks down and you take it to the mechanic, and in this kind of limited analogy, I suppose an osteo, physio, chiro, massage therapist is serving as a mechanic, and take it quickly. Don't wait for that rattly noise to become like an incredibly painful back that has flared up 3 times in the last 10 weeks and is making it hard for you to put your shoes and socks on in the morning, and et cetera, et cetera. I think I went off topic a bit there, but is that kind of where we're looking forward to go with posture?
Yeah, and also just a little bit, I mean, you touched on, which I was going to talk about as well, is the strength, the importance of strength for posture and having strength in upper back, but also in the lower back as well.
Yeah, I think I'd classify, like when you're talking about posture, think about your kind of primal muscles, your trunk moving muscles are really important. And for a lot, that's mostly pelvic muscles, spinal muscles, and to a lesser degree, probably some hip and shoulder. And it's your trunk that you need to keep strong. And I think instead of thinking in terms of strength for posture, think of fitness and fatigue resistance. That's what you're training for, because that's what's going to keep you out of pain longer when you're sitting in an office, or say you're working, driving, where you might be driving 8, 10, 12 hours in a shift, or think of another job would have injuries. It's a kind of repetitive job, like a factory work job. I don't see too many of them anymore.
I think a lot of people don't actually think about that in terms of their back or whatever injury they may have, that they're actually fatiguing it with being sedentary or with whatever activity they're doing as part of their job. They understand fatigue as a concept in the gym when they get tired, repeatedly doing sets or reps or distance if they're running, but they forget that they're actually fatiguing their body with something else they do every day.
Yeah. And it's another reason for, like, if you have a desk job, like, you have to build a habit that takes you away from the desk regularly and keeps your body moving. Your body hates being still. It's ironic, but if you actually try and sit still, try and sit still for 40 minutes. Like, it's awful. You won't. You'll be in a lot of pain by the end of it. You can't sit still. You'll fidget. You'll shift your weight. You'll shrug your shoulders. You'll sigh. Like, these are all, your body is moving itself, shifting itself around all the time. You need to point out some of these things to people to make them realize how much movement is just essential for, like, feeding the physiological kind of mechanisms of the body. Your body's basically 3 trillion cells that move together. Cells need kind of fluid movements and pressure changes to help regulate their environment properly. And I think that's what you're doing. You're moving your kind of thing around to help regulate the environment. You sit in one place. What does tend to happen to your postural muscles, let's say the ones that people complain about, your upper traps or your upper back, the longer that you stay in one place, the organic tissues have this property called creep deformation. So they start to deform. And think of an experiment where you were to get some organic tissue, say something you bought from the butcher, and you hung a weight from it, say a 12 kilo weight from a piece of backstrap. So initially, it wouldn't really change much at all. But if you could measure it, there would be a microscopic increase in length over the first 2 hours. But progressively, it starts to fail. And as it fails faster. That's why you get more uncomfortable the longer that you stay there. Your body literally is like losing its ability to hold you together. When you shift your weight around, you change the focus of the gravity or pressure. It gives those muscles a chance to regroup, to change their shape, and then they're ready to go again. So that's that fatigue resistance and also good habits.
And also with the ladies that I've got, a lot of them are kind of noticing changes either in their bones or they're around, going through the stages of menopause or premenopause. So how much does changes in the bone affect sort of posture, or obviously it's going to have changes to the spine, but what's your advice there?
Systemic changes are big. So your physiological health, your hormonal health, your age, everything rests on that. Your bone health, your muscle health, you name it. It relies on your physiological health. And menopause is big for the age group. I think understanding that it's big kind of hormonal fluctuation, the drop in estrogen seems to expose tendons a bit as well. So like the common thing I'm asking for, if I see a late 40s, mid 50s woman, is these days, I'll ask on first, where are you with menopause now? Because I want to know, because it's usually as that estrogen drops down, you see them, they're more at risk of certain tendinitis tendinopathies, hips and shoulders is what I find commonly. So you can get someone who's kind of peri or postmenopausal. I'm asking them, hey, are you sleeping comfortably? How's the shoulders? How's the hips? It's not all the time, but it's, you often get grumbly hips and shoulders with that group. And I think that's related to menopause. And that bone health is the other side of the thing. You see the decrease in bone density post-menopausally, which is associated with the change in hormonal structure. And you can manage that. A certain degree of it's natural aging, but you need to fight against it. The best thing you can do, and these people all need to be in the gym. They need to be doing resistance exercise. They need to be lifting weights, and not lady weights as much as that's a kind of sexist thing to say. They should be deadlifting and they should be overhead pressing with substantial weight if they don't have injuries.
Yeah. I know. I mean, I'm very grateful and glad that a lot of the ladies that come here to KMJ understand that. And that's what I do. I try and educate them as much as I can on points like you've just mentioned. So
they're a little intimidated at first when you show them, like something that weighs really heavy. I literally will sometimes put 20 or 30 kilos, maybe even 40 kilos on the bar and just put it on the floor and just say, I want you to pick it up. The look on their faces is priceless. And it's then after they've done it and they realise that was hard, but I didn't hurt myself.
Do it, yeah.
And why shouldn't they do it, Why is it okay for a man to throw heavy weights around and not a woman who's, say, 55? It's ridiculous.
It is. I think that's just society and culture over the years that's built up those ideals for a lot of people. And I find the ones that do it here, once they get it becomes a bit of an addiction as well. They quite enjoy it and they look forward to it, and they're seeing the benefits, so they understand why as well. Yeah. So
the biggest change can sometimes just be in their energy levels. If you get them regularly exercising, it can turn their life around from something that was they were tired all the time, sleep was disturbed, and before you know it, they're jump out of bed in the morning. So I think there's a real big benefit for that. That's for anyone really that's not exercising, but you see big turnarounds in, say, so a woman who's never really done structured exercise before and is reaching that stage of their life. If you can get them into the right environment and start to challenge them, it's beautiful.
I know it is. And there's so much more in terms of the hips and shoulders and other topics we could delve into as well, but got to let you go. So I just want to finish with, where can people go to find out more information and get in contact with you as well?
Yeah, great. Thanks. The best places is you can check out my two practices, which is stgeorgehealth.com.au and sydneyhealthprofessionals.com.au. That's one in Cogger in Sydney and one in Broadway in Sydney. And we're on Instagram and Facebook as those things as well. So you can check out those. You can send me an email at, probably best to use Edward, EDWARD, at sydneyhealthprofessionals.com.au if you've got any more questions or you want to send out some advice. But it's been great, Megan. So thank you very much for the opportunity to come on and do a chat.
That's been great. Thanks so much, Eddie. We'll have to get you on the podcast again soon because there's so much more I want to delve into with shoulders and hips and other topics as well.
I've got Skype installed now, so the tech stuff should work seamlessly.
Thank you. Yeah, so thanks so much. That was good. There's so much more I had, but I'm mindful to let you go with time and everything. Right. So we'll have to organise another one a bit later on when you're free and talking more about, because the hips and the shoulders that you mentioned is, a lot I see here with ladies. So
my favourite. So anytime, just hit me up and thanks very much. And I'll see you hopefully in the gym before too long.
Perfect. Sounds good. Thanks so much, Eddie.
Thanks, Megan. Bye.
Bye-bye. Thank you for listening to another episode of the Women's Self-Health Podcast. If you enjoyed this episode, we would greatly appreciate it if you could head over to iTunes and leave us a review. If you had any other questions, don't forget to head over to the website and subscribe for all of our upcoming episodes. And if you have any kind of back pain and you would like to find out more information to help you better understand and eliminate back pain, head over to www.womensselfhealthpodcast, that's womenshp.info/backpain to download our free resource. Thanks for listening, and we'll catch you on the next episode.